Hello, this is Louise. I'm with Jana today. She's a family nurse practitioner with a specialty in nephrology, and we're going to talk about kidney disease and dialysis today. Thanks for spending time with us, Jana.
Thanks for having me, Louise.
So can you tell me about your background and how you came to be in your current job?
Yes, ma'am. Background, both military and civilian. Flight nurse with the Air Force currently, and since '97. I've also been registered nurse by way of Seattle, University of Washington, and also here where I study for the family nurse practitioner at Hawaii Pacific University. I was working as a renal registered nurse with dialysis, acute dialysis here on island when I decided to go back to HPU for my master's study in family nurse practitioner work. And knowing some of the nephrologists here on island, I was interested in furthering and continuing on with jobs here. So that's how I started being a family nurse practitioner here on island.
And how does your job as a family nurse practitioner differ from being a dialysis nurse and differ from being a nephrologist?
Oh, well, with the difference in nursing comes more responsibility. You have to diagnose, you have to prescribe medication, alter those medications in relation to laboratory labs that come back for monthly labs at the dialysis center. Assessments are a little bit more detailed than it was as a nurse. In relation to nephrologists, nephrology have more encompassing diagnosing ability and just more in-depth, hands-on with the patient as far as their CKD. And when I say CKD, I mean chronic kidney disease before they actually get to the dialysis point, and more acute relation when they're hospitalized.
For patients who are receiving dialysis, can you explain the dialysis procedure in terms specifically of what's removed from the blood? Is anything added to the blood? What's actually happening to your blood when you're undergoing dialysis?
Sure, we could talk a little bit about dialysis. The initial part of dialysis, when a patient initially starts dialysis, they'll have a form of access created, whether it's a dialysis catheter, which is outside of the body, or something internally, which is a fistula or a graft that is normally underneath the skin and is accessed by a needle that removes blood that goes to the dialysis machine. Now, once it's going through the dialysis machine, some of the things that it'll eliminate could be urea and nitrogen in the blood. Also, things that are harmful to the body when it builds up in excess, when the kidneys are no longer working and can no longer do that for itself, like potassium, some phosphorus, some byproducts are all removed. Because as we all know, potassium is one of the deadly electrolytes if it builds up in excess. And it's one of the main things that our kidneys eliminate on its own when working properly. So the dialysis machine is used more to eliminate those so that you can prevent heart problems and or death from too much potassium building up in the blood. That's the main critical one that we're always trying to eliminate and make sure it doesn't go too high, along with the urea, nitrogen, phosphorus that we don't want to build up. So those are the main things that are eliminated with dialysis. So one of the key things that I know is added to from dialysis is bicarb and calcium that can be added through the dialysis machine if needed. Those parameters, those conditions can be altered. So what you have with bicarb, and bicarbonate can be added because it acts as a buffer for your acid balance in your blood. Just as you hear the terms in relation to water, the blood can become too acidic, too alkaline, and this causes a person to feel generally bad, like you're in poor health. So having a very good acid-base buffer and balance in your blood is necessary, which with dialysis, you can add or reduce the amount of bicarbonate that's in the blood.
Talking about electrolytes, how do the dietary requirements change when a person moves from just having chronic kidney disease and reduced kidney function to kidney failure and needing dialysis?
Well, two of the main things that patients with dialysis or just with chronic kidney disease would have to eliminate and reduce significantly are potassium, foods that are high in potassium, and foods that are high in phosphorus. Um, just to give you an idea, some of the foods that are high in potassium includes a lot of your fruits and vegetables, which are really hard for patients to eliminate. You have bananas that are really high with potassium. You have orange juice that's really high in potassium. Um, really difficult for patients to kind of move toward it, especially for most of their life where they're told that bananas are really good and they should try to, have that as in their diet. Phosphorus is not as critical, meaning it's not as deadly when it's more of a chronic and long-term effects that would really um, take hold of a patient or be consequential to a patient once they build it up in their blood. But high phosphorus foods include dairy products. Your nuts include high phosphorus. Processed foods, but mainly dairy, I think, and cheese are one of the main things that patients find it hard to reduce. But good thing is there's technology out there where you have phosphorus binders that can bind to the phosphorus in the blood and help a patient live fairly similar lives to before their chronic kidney disease and before the dialysis. So that's the good thing with phosphorus. Potassium, only when it's critical and there are some items that could be added to reduce that, but it's rarely used. First of all, it's very expensive and it's not readily available on the market. There are some things currently that's coming through that that could help with that, and that we're seeing now in today's market that's being added.
I've heard about phosphorus binders. I'm guessing that they're molecules that actually bind to phosphorus and pull it out of the blood. Is that right?
Yes, more or less with the food. So as a patient's eating, they would take these binders while they're eating, and it would bind to the molecules in the food, which would in turn block it from going into the blood.
Are there things people with chronic kidney disease can do to slow the progression of their disease?
Chronic kidney disease primarily ensues by one of two of the most prevalent diseases that cause the kidney disease in the first place, and those two are high blood pressure and diabetes. Um, so in slowing the progression of the chronic kidney disease, what you want to do is just be more stringent and more careful with the diet, along the lines of lower sodium in regards to the high blood pressure, and checking your blood sugar regularly if you've been diagnosed with diabetes, and taking your insulin as prescribed, or any oral anti-glycemics that's been prescribed to you by your primary care doctor, or your diabetes doctor or your diabetes provider. Just really being cognizant of those diets, and keeping the blood sugars in normal range long term, and also keeping dietary sodium, salt in your diet down, and also keeping your blood pressure, taking your blood pressure medication as prescribed, keeping your blood pressure in a normal range will also help slow the progression of the kidney disease.
The incidence of chronic kidney disease in Hawaii has been reported to be higher than the incidence in the general US population. Are there known causes for this increased incidence?
I would say it's attributed to both diet and hereditary. Hereditary, for some reason, in Pacific Islanders, and I would say even in African American community as well, is higher. It could be attributed to the higher sodium in our diet. I know Islanders here, the spam and things of that nature that are really high in sodium can attribute to the higher incidence of the chronic kidney disease here on island, and all islands for that matter.
Are the dietary recommendations for people with chronic kidney disease different depending on the cause of their disease?
Not different from a chronic kidney disease standpoint, but if the cause of their chronic kidney disease was hypertension, high blood pressure related, then their diet restrictions would be more sodium restrictive. If the chronic kidney disease was more from diabetes, then you would see more of a carbohydrate and more of a glucose restriction. But for all case in point, once the chronic kidney disease has progressed and you're focusing on the chronic kidney disease in itself and also a dialysis friendly diet, then you would see the same lower potassium, lower phosphorus diet that we spoke of previously.
You mentioned creatinine. What is that, and why is it used as a measure of kidney function?
So creatinine is you have a breakdown of muscle wasting in the blood that normally is eliminated by the kidneys. But when the kidneys aren't working as properly, they can no longer get rid of that byproduct. And I think that's the term that you hear of where it's referred to as toxins being in the blood when the patient's kidneys aren't working. So it's a buildup of creatinine.
I know in the early stages of kidney disease, there really aren't any symptoms, but as someone progresses to losing kidney function, needing dialysis, what symptoms could they experience?
Okay, well, this list won't be all encompassing, and all patients will, though, exhibit and they'll experience things differently, just as with any other disease process. But I would say the most common, as we spoke of earlier, is the shortness of breath. They'll start to notice that their extremities are getting swollen. So you'll see some edema there, especially in the lower extremities. Quick jerky movements, which could be other things, but that's also a sign that, they're getting into trouble and should be seen by someone. A funny taste in the mouth, which would kind of be like, I've heard it described as a metallic taste in the mouth, almost like they're sucking on a piece of nickel or so. That can also be a sign of kidney failure. What we refer to as urea breath. They may notice a very distinct smell, or others around them may be able to smell a very distinct urea smell coming from their breath as they speak. Could be another sign or indicator that there's some kidney dysfunction there. I would say those are the big ones that you hear of often across the board. But again, just differences in different patients.
For the jerky movements, is there a known cause for that?
Just the buildup of all the toxins. The electrolytes are kind of off whack in a sense. So there's just kind of the excitability that's occurring with the electrolytes in the blood, and just more stimulation.
What impacts of COVID have you seen on people with chronic kidney disease in general, and then people on dialysis?
Well, I would say besides fear, the people are fearful, especially those that I see out in the dialysis centers, where they're coming in 3 times a week, fairly often, and just kind of being more exposed than others. Because there's a disease process occurring in the body, it just makes them more susceptible, just like with any other health risk out there. They're more susceptible, so they have to be a lot more careful in staying distant and wearing a mask. But as far as the disease process or the infection process of coronavirus, you don't see a difference. You may see it, the symptoms, the severity of it, just because of the susceptibility being higher with the renal patients. The actual active infection may be a little more severe.
Have you seen people moving from in-clinic dialysis to home dialysis because of COVID?
Most definitely. Recently, we've seen a huge uptick of patients desiring, inquiring, interested in doing both home hemodialysis or home peritoneal dialysis. And was just speaking with one of the nurses for home dialysis the other day, and he's having trouble keeping up with all of the new patients that are desiring. They're wanting to do it at home, so they're not putting themselves in risk of going to the centers 3 times a week. Yes, most definitely.
What are the interactions you have with patients as a nurse practitioner? I'm guessing you're working with people in the dialysis center, but also patients who are not yet on dialysis.
That was one change that we experienced with COVID as well. As the nurse practitioner with our practice, we were going into the clinic to see outpatients and also do clinics. But to reduce the amount of exposure we were both giving ourselves and the nephrologist we work with in the office, we decided as nurse practitioners we would primarily focus on the dialysis centers. And that entails 4 times a month a visit according to Centers for Disease Medicare state is adequate visits to see the patients. So we do see them fairly regularly. I try to see my patients still in person, just using a mask, but some of the other nurse practitioners that I work with, some other peers and partners we incorporate telehealth visits as well into the visits that we see in person to make sure they're still getting adequate care, even through the pandemic.
Can you tell us what a typical day for you is like?
Yes. So there's several clinics I go to visit patients. So in the morning, I wake up, start off with, have a schedule of which clinic I'm going to visit. And there are 3 shifts at each dialysis clinic. Some actually have 4. Those that have a larger population there at that clinic, they have 4 shifts. So in those clinics that I'm deciding to go to for that day, I'm visiting 3 times a day at each clinic. Seeing the patients toward the beginning of the month when the labs are being drawn, full assessments, seeing the patient, listening to their lungs, listening to their heart, checking them for edema. Because even on dialysis, some patients, depending on how much fluid they drink, can still have that same buildup, and their what's called dry weight would have to be adjusted. So adjusting those things, looking at their labs, checking their potassium level for the month, checking their phosphorus level for the month, and changing medications based on those lab values that are returned. In addition to that, their dry weight, which just like normal, people without kidney disease, their weight fluctuate either up or down, adjusting the weights with the patients. And then sometimes just being an ear, hearing about their other appointments, whether it's with a heart doctor or so, and helping them navigate changing blood pressure medications that needs to be changed. Because they're seeing me a lot more often and their nephrologist a lot more often than they may happen to see their main primary care doctor. And it's just a little bit more difficult to get in to see those other providers currently with the pandemic. So just helping them out and adjusting things that they need, helping them navigate our new normal.
What is dry weight and how is that used in monitoring patients?
The term dry weight, is essentially the weight that a person would be if they had full kidney function and their kidneys were able to get rid of all excess fluid. That's not their general true body weight without additional fluid. With that being said, you have key indicators that would help me determine what their true and actual dry weight is. And this is used by listening to their lungs. You don't want to hear any adventitious sounds, no crackles that we refer to in the medical world, which would be an indicator that there's fluid buildup in the lungs. We look for edema, swelling in the legs that would indicate there's excess fluid. And also blood pressure is a very good indicator to let you know if there's excess fluid on the patient. A higher blood pressure tend to let us know at the dialysis clinic that they should be a lower dry weight. technology doesn't have it currently to where we can do one full body scan and see exactly how much additional fluid is there. So we use those key indicators. If a patient's naturally not eating and they're losing weight, or they're deciding that they want to exercise to lose weight, then naturally we would lower their dry weight, because there's probably more fluid on board if they're losing natural weight. So the term dry weight is just kind of synonymous with their natural weight without any excess fluid.
So what advice do you have for anyone actually?
Just keep yourselves healthy. You know, right now with the pandemic going on and all, it's a little bit more difficult to keep yourselves healthy. Gyms are closed, or you just have fear of going to the gym for fear of catching coronavirus. But you still want to make sure you take care of yourselves. And if you should happen to be unfortunately diagnosed with those things of high blood pressure or diabetes, just really taking care of yourself and doing what's necessary to make sure you prevent um, chronic kidney disease and dialysis from occurring. So prevention still prevails. And so just stay healthy, take care of your diet, take care of yourselves, and most importantly, take care of each other.
Thanks again for taking the time to talk to us today.
Oh, thank you very much, Louise and Phil, for having me. It's been my pleasure. Thank you very much.